Even well-intended people often find themselves blundering when speaking to a person with a disability. How do you acknowledge a disability on one hand, but not embarrass yourself on your disabled friends? Is it okay to call them handicapped or describe them as someone who is suffering with a disability? What about that person who is visually impaired, hard of hearing, or sitting in a wheelchair? How do they identify themselves? Eagle Eye View's Maya Holmes has this report.
People have been using the word handicapped for years. In fact, since 1504. In 1504, after the brutal war in England, King Henry VII's country was left with a significant number of disabled veterans. He could not envision them being able to hold a job or contribute to society, so he passed a landmark legislation to make begging in the streets for money legal. Into the streets, with cap in hand, went King Henry VII's veterans, begging for money. For many with disabilities, the word handicap is demeaning and misrepresents them.
Handicap to me is a word that was used back in the days where people who had disabilities weren't unable to work, so a lot of them would go out and pretty much beg for money. They would use their cap, and so people could put money in their cap. So that's how the word came about, handicap. And personally, I'm not a person who goes out and begs. I work, and I just like the word handicap.
And like handicap, terms like retard and crippled, just to name a few, are all demeaning, disrespectful, and hurtful references. Although language is powerful, actions, attitudes, and behaviors are important when dealing with such people.
Interacting with an individual with a disability, protocols, at least here in the healthcare setting, all patients have the right to be treated with respect. So someone with or without a disability here would be treated in the same way. Someone with a disability, depending on what that disability is, might need an accommodation that we'd have to make, but otherwise, it's treating everyone with respect.
Describing someone with a disability as disabled or differently abled are not always appropriate. What about who they are outside of their disability? People often view them as incapable or helpless and equate their disability with disease. They feel sorry for them and sometimes adopt a strong urge to help that girl roll her wheelchair up the small hill, even though she has done it a dozen times before. Or assist the visually impaired man find his way to class, even though it's the 10th week of school and he's been going there all quarter. We often assume someone at home is primarily taking care of them, when that is not always the case. In the back of our minds, we wonder about their quality of life.
I would identify myself as a person living with a disability, but not identified by my disability. Some misconceptions about people who are disabled are we can't do the same things that people without a disability can do. Even though I may be confined to a wheelchair, I would say I am as independent. I am as independent as an able-bodied person, and actually, I have done more things disabled than I probably would have 40 years able-bodied. So I think my disability has been a blessing to me.
So, proper etiquette and identity with people who are disabled can be confusing for some. Here are some helpful tips. Be yourself. Treat people with disabilities with the same respect and consideration that you would have for everyone else. Do not automatically help. If you would like to assist, ask the person first if they need help. Speak directly to them. When talking to someone with a disability, it's important to make eye contact. Identify who they are first. When identifying a person with a disability, identify who they are first, then their disability, if needed. Never use the word handicapped. Words like disabled or differently abled are more appropriate. From North Hollywood, I'm Maya Holmes for Eagle Eye View's Accessibility.
For more information on disability identity and etiquette, go to our website, www.coolstatela.com.